do it. All right, I'd like to call this Ways and Means Committee meeting of Tuesday, October 5th to order. I know, but they wanted you to hustle. So, could you do roll call, pretty please? Okay. I'm here.
Here?
Yeah, here.
Here.
Here. Here.
Yes.
Right down.
Okay. Are there any changes to the agenda?
Right number right there.
Hearing none, is there then a motion for approval of the agenda?
So move.
Support.
Discussion? All those in favor?
Aye.
All those opposed? Motion carries. Is there a motion for approval of the minutes?
So support.
Moved and supported. Any discussion? All those in favor?
Aye.
Opposed? Motion carried. Moving on to item 6, public input. Anyone wishing to speak?
Thank you, Madam Chairperson. I just want to give an update to the committee and the commission. Chris Pinter, Bayerneck Behavioral Health. I was here 3 weeks ago at the regular meeting, and I gave you an update on the Senate bills. There's a couple of privatization bills for community mental health services. So there has been 3 hearings in the Senate the last 3 Tuesdays. There's been a lot of testimony taken. Most of it's been in opposition, but I get the sense that the testimony is maybe not as reflective of the high degree of public opposition as there really is out there. So I've tried to testify a few times. Senator Barsha is helping me try to get on the short list to give verbal testimony. So right now I think that it's probably likely that these will be reported out of the Senate because the Senate Majority Leader is the sponsor. But we're not hearing anything in the House that would suggest that it would necessarily be taken up because Representative Whiteford is kind of leading the House's mental health, and she has a little different perspective than the Senate version. But I just wanted to keep it posted. So we're just keeping an eye on it. And there's, I'm going to leave this with the commission. We get alerts from our association sometime on, staying in touch with your state senators and representatives on this. And if it's okay, Madam Chair, maybe we'll send this over to Deanne just to share with the commission. And that's all I got.
Thank you. Vaughn?
So at the conference, I got a chance to talk to the representative from the House, and it sounded like she liked the Senate version, so it might get through the Senate, but not through the House.
Jim?
Oh, Jim, I'm sorry.
While you're here, Chris, have you reviewed the Cali? Is that the bill you're referring to in the House, the Julie Cali bill?
I've not seen hers. Is it about mental health?
Yes.
Has it just come out recently?
I saw a reference to it, and I wasn't sure what how it would impact us locally.
I'll reach out to her. She's usually pretty responsive to mental health issues. It was her and Lieutenant Governor Kelly that basically stopped the 298 5 years ago. So I will reach out to her. I appreciate that information. Okay.
Thank you.
Thank you.
Anybody else? No? Okay. Moving on to petitions and communications. Angela Garner.
Good afternoon, everybody. I appreciate the opportunity to speak before you today. I am the county's insurance agent, employee benefit consultant. So we were asked to come and do a health insurance update, and so I put together some numbers, some historical information about the county's healthcare costs and benefits that you have, particularly medical and pharmacy benefits. So just a little bit about us. We are located in Saginaw, Michigan, but Brown & Brown is a nationwide entity. We're the 5th largest insurance intermediary in the country with over $2.6 billion in revenue, which represents over 300 offices and over 11,000 employees, or what we call teammates, across the country. The reason that is important to you is that because that brings you some leverage based upon the premiums that we have in our book of business across all of our employee benefit space across the country. I also am your direct account manager, even though I run our office in Saginaw, Michigan. Several of our teammates actually live in beautiful Bay County, so we enjoy coming up here very much and working with your team. The individual people that you have on the screen there, those are representatives from our office that actually assist the County of Bay. We are local, and we work to help you on many fronts. So up there you see myself, and then Tara Paget as an account manager. Judy Robinson is our customer service manager, and then Brandon Westlock is our benefits operation manager. Charlene Orange is our benefit analyst for you, and then the three individuals left are Farron Brayman, Rebecca Castillo, and Olga Roberson, and those three individuals help your members with claims issues, billing questions, etc. To jump into Bay County's benefits, we have serviced your account and worked with you for many years. So this data that I have back in the presentation is from 2005 forward. But I wanted to talk a little bit about how you're funded. So you can finance your benefits many ways. You could be a fully insured group where you actually pay a premium every single month, and then the carrier pays the claims. Out of that premium, they take their taxes, any pooling fees, which are also known as stop-loss fees. They take commissions out of that, overhead, administrative fees, and then lastly, part of that is always the reserves and profits. So you are actually fully insured on your Medicare Advantage plan for your retirees that are Medicare eligible. And even though the fully insured model has some additional features that the self-funded doesn't, there are some caveats that make the Medicare Advantage very welcoming to you. Thus, in the fact, the plan itself includes Medicare Advantage and prescription drug plans, and the government actually subsidizes that. Also, the carriers who run Medicare Advantage plans are guarded against increasing rates at a manner so much that they increase their profits and reserves. And so they're limited as to how high they can increase your plan every single year. And then they're rewarded or subsidized by the government based upon how well they're running their plan. The better the star rating for a Medicare Advantage plan, the higher the amount of money that they get in the upcoming year. So on the other side, we have your self-funded plan. Your self-funded plan, you have a couple different components. You have Blue Cross Blue Shield, which is an administrative services contract. They run your medical and your stop loss on your medical. You also have EHIM, which is your pharmacy vendor. And then last but not least, you also have these wellness center components that you have with Dr. Potts's office in the Bay City area. So as part of the Blue Cross contract and the EHIM contract, what you are paying are actual claims and then fees that support that claim. So what I have on top is you do get a gray area of potential savings after you've paid claims and fees as opposed to being fully insured. Groups that are fully insured do see that their premiums are going to cost them on anywhere 5 to 30% more than what you're paying under your self-funded contract. And the reason for that is because the carriers aren't going to lose money. They rate you appropriately so that they have enough money to pay estimated claims in the upcoming year. So under the self-funded plan, you do have administrative and some agent fees, and there's also taxes as well. Being self-funded gives you a lot of control over your plan, which has benefited you over the years. And we're going to walk through some of those numbers. So I first want to talk about stop loss, because the number one thing, and just to give you a little bit of education, I know I've been in front of most of you before, but the stop loss is what protects protects you against catastrophic claims. So under your Blue Cross Blue Shield contract, you have two features. There is a specific stop loss component, and then there is an aggregate stop loss component. The specific protects you on a contractual basis. So every single family that you have insured with Blue Cross Blue Shield, you pay the first $200,000 worth of claims today, and then Blue Cross picks up that difference. But for that, you pay a fee that's called specific stop loss. In addition, you have an aggregate policy. That aggregate policy is kind of like an umbrella policy, if you think about your home or auto insurance. So specific, you can put kind of like the deductible of your policy. Because of the number of individuals you have insured, your deductible is $200,000 this year per contract. The aggregate is set at 125%, and that is 125% of what is expected. If you go over any of those components, Blue Cross reimburses you for that difference. And so even though you are self-funded, you are capped at how much exposure you have by those two insurance components. Any questions on that before I continue? All right. So up here on the screen, I have a couple of different years here for you to see. I know you all know that the coronavirus has impacted us many ways, right? It has also impacted claims. Last year, we had about 3 months of times, March, April, and May, and then also in parts of November and December, where some of your employees, and not just your employees and retirees, but a lot of our member groups were avoiding going to the doctor. They were avoiding having services. They put off services that they may have needed. Some pre-scheduled surgeries got delayed. And so we're seeing some of that impact today. But if we look at your plan and we're looking at it, I provided data up here. So there's 3 charts up on the left-hand side, and then there's a chart on the right-hand side. So the very top one is 2020. So that's the year that is kind of the anomaly as we're looking at it. I have in 2020, memo total for medical claims is about 3.6 million. You'll see that 15% of your claims in 2020 were under $5,000. And then 85% of your claims were over $5,000. You've probably all heard about the 80-20 rule in insurance, that 20% of your people have 80% of the claims, 80% of the people have 20% of your claims. And so that's very true here with what we're seeing with the under and over 5,000. You're at 85-15. I would tell you when I first started about 17 years ago, the $5,000 level was the level that we would look at. Now we're more at $10,000, and I would say you're very close to 80-20. You can also see in those charts what the average claim cost was. So in 2020, the under 5,000 was 1,350, the over was 25,000, and the average claim across your entire population was $6,903. Remember, this is just the self-funded, so this does not include your Medicare Advantage retirees as we're reviewing this. For 2019, which was a more normal year, you'll see that total was actually a lot higher, 4.46 million, and your percentage there was more in line with the 17.9%, and that is an error there, but it should be 83% on the over 5,000. The average claim in 2019, much higher than it was in 2020. So we definitely see the impact of coronavirus in your claims. It went from $10,050 on average to $6,900 in 2020. And then I also included 2018, just so you had some additional history there. And again, the 2018 information was also more than 2020 with 3.9 million. We do see a 13.88% split there, with the average claim being $8,858. And we do see your plan go up and down. You'll actually see some charts coming up that has that information in it. I have put 2021 year-to-date on the upper right-hand corner there. And so this is data through July. We usually are a couple months behind based upon when Blue Cross can provide us the data. But you'll see that the average claim this year is so tiny, $6,585, and you're at a 16%, 83% differential right now. So your group is definitely taking advantage of the the stop loss here. And I'll just say that because it's important that when we're looking from a pricing perspective, that we're picking the right level for you based upon how many claims go over stop loss and how Blue Cross Blue Shield prices that stop loss component. So on the bottom right-hand corner, what I have for you is just information over the years and your different stop loss levels. So we have varied it. You see some 200,000, you see 190,000, and then you'll see for 2022 on the bottom lines, we're actually looking at doing an increase on the stop loss. And I will tell you, back in 2018, Blue Cross changed their way of pricing stop loss. And so what they changed from was a system where the entire book of business in Michigan that was non-auto, self-funded, were all rated together for stop loss purposes. Back in 2017, 2018, they started looking at it differently, and now they're looking specifically at each group's experience in addition to their book of business. So you have had some experience, and you'll see on the side there's claims over stop loss for the various years. This year, we're already at 2 claimants over your stop loss level, but that's the value of insurance, right? To make sure that we are protecting those who need insurance when they need it the most, right? But also providing insurance to everybody. And so with the pricing increase this year, we're actually going to be moving that $200,000 to $250,000. And as we look over the years, we've got 7 years there. You really haven't gone over 2 claimants. And when I look at the price of stop loss, I always think, okay, how much exposure, how much liability would the county have? And when we go from 200 to 250,000, that would be an extra $50,000 per contract, right? With 2 claimants on average, if we move you from 200 to 250, if both of those individuals cross the $250,000 threshold, that would be $100,000. The savings on going from $200 to $250,000 is more than that to the county based upon your number of contracts. So that's why we're making the recommendation to move that this year. And you are allowed to move that up and down every single year within Blue Cross's parameters. What we're always trying to do is finding the best price for your money. With the number of contracts that you have, knowing you are a public entity, we also know you can't increase the pricing of your goods. You can't change your union contracts as far as the benefits you offer. So we want to be very conservative in what we put out there so that we're protecting your financial best interests, being the fiduciary of your health insurance plan. So here's when we start getting into claims, and I know this is a lot of data. I'm not trying to overwhelm you, but what I really want you to see is kind of the picture, and we're going to start with the dollars of claims on the left-hand side. This is specific for actives, and what I have is information by color. You'll see the light blue is your medical claims cost, the gray is pharmacy, and then that dark blue is medical, pharmacy, and all your fees. And you definitely see the trend of healthcare every single year. There are some years that it goes up and down. You will note that if you're looking at that gray bar, in 2012, you see a significant drop in the pharmacy. But overall, the pharmacy has been very steady for Bay County, and EHIM has served you very well over the years as far as protecting how much your claim liability is. In fact, for the past I want to say like 7 or 8 years, those pharmacy claims have been pretty stable, within $100,000. On the right-hand side, what you're going to see is percentage increases and decreases. Again, there's multiple colors. So I do have the overall percentage increase, which is that dark blue. So that is medical and pharmacy together. And you will see spikes, and there's been years where it's been less than 0%. So that means your trend's actually gone down on the medical side over some years. You also see that medical is going to be that light blue, and that one has probably the most dramatic turn of ups and downs when you look at the highs and the lows of that. The gray is going to be your pharmacy. That's a little more consistent, but again, you're going to see more lows than highs on that as far as percentage increases over the year. And then to put a base in there just for some perspective, Siegel does a trend every single year based upon employer health care plans across the country. And so I wanted to show you what an average trend would be just so that you can see where do you fall in line. And so this is very typical of a self-funded group, right? There's going to be good years, there's going to be bad years. years, but you have the protection of that stop loss in the bad years to protect you against those catastrophic claims that come in. So, when we look at 2020, you're going to see some of those numbers coming down because we had a lot of people not coming in for services. As we go forward in 2021, the expectation is we are going to see some of those claims come back in, plus some of them are going to be a little more severe than they were before, just because they put off care. And then just because some of you may want to see the numbers and the actual percentages rather than in the chart, I did put a table in there so you can kind of watch the claim differential. And just like I said, you can see the pharmacy went from 482 to 673,000. And then in 2013, we brought in EHIM, which they have been very consistent and steady within $100,000 since that time period. You'll see the actual number of contract counts, because that's the other thing. We can't just talk about cost without looking at the number of members insured, right? And so you'll actually see from 2005, we had about 313 families insured. This would have been, again, just the actives. And today, there's 357. So there are probably a lot more things that the county does today than it did in 2005, just even because of some of the state mandates. So that definitely explains some of the increase in your member count. But we also know, too, that during this time, finding employees and finding talent is difficult. So that number actually could be a lot higher, just based upon the number of employees that you're still looking for today. You also have the percentage increases and decreases for each line, the overall, the Siegel trend that you can see there, medical and pharmacy. For retirees, we did the same thing. So again, this is going to be a little different. So the part of this that is different is not only do we have the Blue Cross self-funded information, but I'm also including the Medicare Advantage too. So you have the Medicare Advantage fully insured premiums in here. And so on the left-hand side, when we're looking at dollars of claims, the first blue, and it kind of looks the same, but it's not, I promise. I would say the dark blue, the first one is for medical, the light blue is for pharmacy, and then you won't see it, but the teal comes in 2017. That's for Medicare Advantage. So there's a little gap in there. And then the claims fees and Medicare Advantage is the total, or the black bar that you see there. And you do see kind of the same kind of thing happening. Once we implemented Medicare Advantage, you did get an additional charge that year. And the only reason that 2017, when you implemented Medicare Advantage, went up is because when you're in a self-funded plan, claims just don't stop when you switch to go to a fully insured plan. Members who had services that we called incurred but not reported didn't come in until the next year, right? So there's a time period when those retiree claims came in the next year, and then that's why you see starting in 2018, 19, and 20, those amounts going down. If we could have priced or showed you what that Medicare population had actually been costing you in claims prior to Medicare Advantage implementation, you would have seen that number about 30% higher than where you see that Medicare Advantage line. So by moving to your Blue Cross Blue Shield Medicare Advantage plan, you did have a savings on those individuals, and you probably also saw an immediate impact on your next OPEB actuarial study as far as a decrease in your liability for retiree health care. On the percentage increases and decreases, it's a little flatter here, but this population is a little smaller than your active population too. And the fact that we did put Medicare Advantage in place, you see that significant drop on the pharmacy in 2017. So those high-cost claimants that we had on the self-funded side had a lot of pharmacy that went with them, because we were able to put them into this fully insured plan where Blue Cross now has to pay for their claims as opposed to Bay County having to pay for their claims. You see that significant drop in the gray line from 2016 to 17 on pharmacy. You still see that ebb and flow on the medical and pharmacy across the board. And then when you're looking at the self-funded lines for medical and pharmacy post-2017, that is just the Blue Cross Blue Shield self-funded policy. Yes?
I got a couple of questions. Basically, we're looking at the black line as our total cost.
Yes.
And that's just general fund?
For your retirees?
No, the retirees, they follow the fund that they retired from, so a lot of them are general fund because many grants and such, they don't continue to pay for retiree health care. So wherever the employee, the day they retired, whatever department they were at is where that
All
would
right, so that's all the retirees. At some point, I'd like to know what our total cost for healthcare for the general fund, and maybe Angela, you, I don't know, would get that for us.
No, we could get that for you. Angela wouldn't have that.
But I got a question, go back, I think one page or 2 pages. You said that, what years were the COVID? Is it 19 and 20?
So COVID is 2020 and parts of 2021. But in COVID, when you're thinking about the months of the year that we really had the most significant impact, is we can immediately see a decrease in claims beginning March 13th, 15th, as our doors shut, right, and we went home.
In 20?
In 2020. And that extended through June, when some of the stay-at-home items were lifted and people could start going out.
I think on 2020, our claims plus fees were higher than they've ever been. So if people weren't, and I heard you say that, maybe I did not hear it accurately, that because of the virus, people were staying home, weren't having procedures done or seeing the doctor, yet our claims plus fees were 4.7.
Yeah, so part of that is, great question, Commissioner Coonan. Part of that is that when we talked about stop loss, those couple of individuals that you have that have what I would call catastrophic claims over the $200,000 level, those got more severe that year. And then those who, when we look at a percentage of claimants as far as, pharmacy was a strange thing. Pharmacy continued through COVID. People still went and got their medications. There weren't issues with that, right? So there's no additional trend that are put on pharmacy. But on medical claims for this past year, there was about a 3% additional trend from COVID. And then this year, 3.5% more. What we had happen specific for Bay County on your active side is that there were some individuals, and I think it's just part of self-funding, you have good years and bad years, that were maybe not the catastrophic, but had some higher claims. The majority of your population did have lower claims, though, in 2020.
All right, thank you.
Okay? So that is the retiree table with Siegel there for you as well. And then the last component that I want to talk about that's self-funded is your wellness center. And so the components of the wellness center have changed over the years, but the one thing that hasn't changed is how you pay for it or what you're paying for. So you have not only lab charges that flow through the wellness center, you have some pharmacy components that now appear through Anderson pharmacies and Meyer pharmacies at zero copays, and then paid directly to the wellness center. In the past, there were utilization fees and maintenance fees. Now you just pay a monthly maintenance fee. And so the combination of all that is shown there too. And you'll see that's pretty flat. 2021 is just year to date through June. So it'll probably be in the $320,000 to $330,000 range as well. But we wanted to make sure that you had all your costs here together when we were looking at health insurance as a package, because the wellness center is definitely a component of some additional costs for health insurance. And so the wellness center, just as a reminder too, can be used by any active employee. We highly encourage, if we were trying to increase the benefits of the wellness center, we would want more individuals to use that. They pay zero copays when they go in for service as a wellness center individual, as opposed to when they go to their doctor's office and they have to pay their office visit copay. They have acute care, urgent care right at the wellness Center as well, too. So there's some great benefits. If we could increase care there, we would see fewer charges on the Blue Cross side. The total combines everything together. So here you're going to have the active dollar amounts from the slide that I had, the active, medical, pharmacy, and claims. You're going to see retiree, the same thing, medical, pharmacy, Medicare Advantage, and claims. You're going to see the Wellness Center component being added in 2014 for a grand total year over year. And again, this data is from 2005 to 2020. 2021 is, of course, we only really have data through July and August right now. And then next to that, I have a county trend. So when you're looking at everything overall, you'll see your highest trend was actually 18.82%, but there's been a couple years when you've actually had almost negative 10% trends in the cost of care. And when I, as far as trying to compare this to where does the rest of the country sit as far as cost of care, I had the Siegel trend line up there before. So Siegel does some national benchmarking, and they look at, this is specific to PPO plans across the country, and they're looking at trend there. So you see the various trend there ranging anywhere from 5.1 to 9.6%. And what I wanted to show you on the very end is if you had that national trend every single year based upon total cost in 2005, where would you be today? And so your total cost in 2020 was about $7 million for actives, retirees, wellness center. And then the Siegel trend, if I had followed the Siegel trend every single year since 2005, your cost would be about $9.3 million. So even though we're seeing some increase in the cost of your care, Bay County is definitely doing better than the Siegel trend. And there's a couple of things that I want to just point out with that. So you're doing better by about $2.23 million and by about 32.66%. So some of the things that have helped you over the years is moving to EHIM, moving to Medicare Advantage, and even utilizing the Wellness Center, even though I would tell you the Wellness Center, when it was first created, it definitely had more advantages as far as cost control than it does now, just because of what we've had to do to modify it according to EEOC and the ADA requirements that the federal government has put on us. So, but overall, even though we have some catastrophic claimants, we are seeing some increases in some of the stop-loss fees that Blue Cross has. Bay County is, its plan itself is running fairly well when we compare it against others. And especially since you're a public entity, we typically see our public employers running higher than what we would see for a national trend as we think about private employers. Bay County is doing very well.
Any other questions?
I move to receive.
Support.
All right, any other discussion? All those in favor?
Aye.
Those opposed? Motion carried. Thank you.
Thank
That's
you
a lot
so
of data.
much.
Like, I
Yes,
feel like I should say something and it's all swirling in my head. But thank you.
You're welcome. Thank you very much for your time today. I appreciate it.
Okay. Moving on, the probate court is seeking approval of the 21-22 CASA contract.
So moved.
Support. Is there any discussion? All those in favor? Aye. Those opposed? Okay, motion carried. Item C, number 1, seeking approval of memorandum of understanding with Mid-Michigan Community Action Agency.
So moved.
Support.
Moved and supported. Any discussion? All those in favor? Aye. Those opposed? Motion carried. Seeking renewal of the site agreements between Bay County, Coquitlam Township, and Hampton Township with the Department of Aging.
So moved. Support.
Moved and supported. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Also, Department of Aging is seeking a renewal of the 3-year site agreement with Williams Township.
So moved.
Support. Any discussion? All those in favor? Aye. Those opposed? Motion carried. 911 Central Dispatch is seeking approval to purchase the Crew Force and Shield Force software.
So moved. Support.
Moved and supported. Any discussion, Mr. Coonan?
Yes, I think somebody from, 911's here. I was reading that, and that's good, good information or good software for these folks to have, both the police and the fire. What are they using now? They must have some, this must be an upgrade. I would.
Yes, sir. Yeah, so right now, basically, they can, by using the devices or the devices in their vehicles, or even a remote link to our computer-aided dispatch, they can read the narratives. This does so much more than that. This does automatic vehicle locations. It can let them know when we have alerts for officer safety or really anything, even a gate code can pop up. It can even do instant messaging between dispatchers and responders and so much more. It covers a lot of things that we've tried to really put together with third-party vendors, and it connects directly with the software that we're already using, so kind of seamless transition.
Is this a statewide software package?
It's not statewide, no sir, but anybody who uses New World or Tyler technology has the capability to purchase it at the costs that they're looking at. We even in the future can look at some cost sharing initiatives, especially with Sandlot with our CAD project as well.
Okay, well, thank you very much.
Yeah, thanks sir.
Anybody else? All those in favor?
Aye.
Those opposed? Motion carried. Item E, requesting the purchase of a Zamboni for the Civic Arena.
So moved.
Support. Moved and supported. Any discussion? Mr. Coonan?
Yeah, I think we have to recapitalize, and I do support that. But again, as Angela provided us information over the last number of years on healthcare, it's been a while since we've received anything on the financials for the ice arena. And, if we can, for next week, I would imagine that information's already compiled. It's just a matter of providing it to us, to look at this year and the previous 2 years, which I think would be somewhat COVID, and maybe going back to 19, which would be a full year, to look and just see exactly how we're doing there. So if we could get that I support it, but I'd still like to see some information, because if somebody asks me a question out in the public, I would like to be able to give them somewhat of a...
I can actually get that to you pretty quickly. I do keep record of that, and I keep a spreadsheet. And in reference to 2020, I tried to keep pretty good notes about when we were required to shut down and when we had to take the ice out and put it back in for all the state mandates. So I can get that to you right away.
Yeah, we can get it to everybody, though.
Sure, absolutely. One point of clarification, I could have been a little bit more clear in my memo. This will require a budget adjustment from the general fund, and I just wanted to make that more clear.
And also, it would be 2022 when we'd expect to make that payment?
Yes.
Because there's a lag time between ordering the equipment.
Yes, thank you. Yes, that's a very good point. So while we would need the budget adjustment this year in order to issue the PO to actually order the Zamboni, they don't require payment until we receive the machine. And so there is a 9-month wait in order from the time you order it to the time you receive it. It's about 270 days. So we would not be paying for this until well into the 2022 budget cycle. So.
Now, would that be part of your 2022 budget then?
It is. Currently, it is on our recommended list. If you approve the expenditure and the budget adjustment now, I would then be able to take it off.
Any other questions? All those in favor? Aye. Those opposed? Motion carried. Okay, item F, seeking approval of the 2021 personal property tax assessment roll preliminary rates.
So moved. Support.
Moved and supported. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Item G, seeking approval of the 2021 assessments from the Drain Commissioner.
So moved. Support.
Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. And then seeking approval of the tuition reimbursement for Alexa Ponaz.
So moved. To receive. Support.
Oh, move to receive. Sorry about that, thank you. And supported. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Seeking approval of the general fund payables, right? Yes.
So moved. Support.
Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. And is there a motion to receive the analyst of the general fund equity?
So moved. Support.
Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. And seeking to approve Executive Directive 2007-11.
Move to receive. Support.
Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Okay. Are there any referrals? Unfinished business? New business? Is there a need to go into closed session?
There is not, Madam Chair.
Okay. And miscellaneous? I keep looking at you, Vaughn, waiting and waiting. Go ahead.
So some of us were at the conference up north, and I guess we all got to attend some different sessions. I went to the mental health funding one with Alan Bolter, which we talked about already. It was quite informative, and he's got his perspective about keeping things at local level and maybe not going with the managed care type setup. So that was well attended. One of those, the ARP, the recovery plan session was pretty well attended also by a larger crowd there. I went to one on the road funding, the Public Act, which I still don't understand. This is pretty complicated.
Yeah, public act.
Cram Noyola talked about that. It was sort of interesting, but sort of complicated funding. Mr. Barsh has probably been down there with all those different funds where everything goes. So, and I don't know if anybody else had any good sessions that they attended. But
I also attended the broadband. One of the interesting takeaways from that one was the FCC, and hopefully I get the words right, but they awarded $9 billion in contracts to these companies to start putting broadband in rural areas, and they've only actually sent $380 million. So it's tied up in political tug-of-war. And I found that to be very frustrating. And then some of the folks that receive some of these contracts, and it's nationwide, because it's awarded, they've blocked other companies, because they've defaulted, so some have defaulted, and then they've blocked other companies for coming in and trying to take over the contract or do the work. So it sounds very politics to me, to be honest, which much of my area is rural, and of course very frustrating to me. So I don't know if anyone else has anything else to share differently than what they attended? Nope. Okay. Any announcements? Oh, Jim.
Well, on behalf of Vaughn and I think we're the only two Bay City Lions in the room currently, but Sandy Fisk, a former president of the Bay City Lions Club, took on as a project, was it 3 years ago? Yeah. The Pawapalooza at the fairgrounds at the canteen, and I know Vaughn worked there the entire day, and a lot of Lions were out there, and the club raised enough money, well, it would have been $5,600, so it's $2,300 to the shelter, to our animal assistance and adoption center, and then also $2,300 for Leader Dogs for the Blind. So it was a great day, good turnout, a lot of support from the public, and it was really encouraging to see all the Lions members who came out to volunteer and help and also donate to the cause. So we're very grateful to Sandy and every Bay City Lion for what they've done. And thank you, Craig, for all the coordination and work with Sandy and the volunteers.
All right, anybody
So,
else?
Madam Chair,
Yes, sir.
I would move to adjourn. Support.
Moved and supported. Any discussion? Our work is done. Thank you, everybody.